Hey everybody, we're back with another heart today. This is number 267 in our collection, and the heart would have sat roughly in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head or superior here, legs are inferior here, left over here, and right over here. I'm just going to highlight kind of the key feature that we'll be reviewing today initially before we start off with going through the specimen. Here's from the left ventricular aspect, and we can see that in the ventricular septum there is a defect. So we have a muscular, trabecular, ventricular septal defect in this heart. But why don't we go ahead and start off as we usually do, which is by going ahead and identifying what externally appears to be the right atrial appendage. And here we find an appendage that's broad-based, pyramidal, or triangular in shape. So we'll go ahead and open up the heart here. And when we do that, we do find pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. We do find the oval fossa here, which looks like it might have a little bit of a defect right there. And then here we find the mouth of the coronary sinus, guarded by the Thebesian valve here. Here is the tendon of Totaro. And we know that the tendon of Totaro, the mouth of the coronary sinus, and the right-sided atrioventricular junction form the triangle of Koch. And at the apex of the triangle of Koch is where we expect to find the atrioventricular node, so we'd expect the AV node to sit here in this heart. Now before we move on, also highlighting the superior caval vein, which is here, draining into the roof of the right atrium. So here is the mouth of the superior caval vein, here's the oval fossa. Now we come to the right-sided atrioventricular junction, which is guarded by a valve that has 3 leaflets. It also has direct connections to the ventricular septum, consistent with the morphologic tricuspid valve. And the ventricle that it opens up into has coarse trabeculations, and there is a septomarginal trabeculation, aka a moderator band, all consistent with the morphologic right ventricle. And here from the right side, we can see this ventricular septal defect, which is a bit removed from the tricuspid valve and is not within the Y of the septal band, which would be the cranial and the caudal limbs of the septomarginal trabeculation. So this is neither a central nor an outlet defect. This is in fact a trabecular defect, and it's completely surrounded by muscle, so this is best described as a muscular, trabecular, ventricular septal defect. Here's the first arterial valve. It's got 3 leaflets, 1, 2, 3, with 3 sinuses, completely supported by muscle. And as always, note that the actual true annulus of this valve is actually crown-shaped and not oval or round. The half-circle fibrous valvar leaflets have these triangular myocardial portions that are interposed in between them. Thus, the circular or round or oval shaped annulus that we create, while clinically helpful, is not a true anatomic feature of the arterial valves. Here's the pulmonary trunk, and we can see there's a band that was placed here at some point in life. Now, when we go ahead and look at the posterior aspect of this heart, we'll go ahead and open the other atrium. Here we find a smooth-walled atrium. Here is the back of the oval fossa. Here are the horns of the oval fossa. Here is the left atrial appendage, and here is the mouth of the left atrial appendage to the left atrium. All the pectinate muscles are confined within the appendage itself, all consistent with the morphologic left atrium. The left-sided atrioventricular junction is guarded by a valve with 2 leaflets, 1, 2. This valve has no direct septal connections, consistent with the morphologic mitral valve. So here is the anterior leaflet, and here is the posterior leaflet, and the asymmetry in these leaflets is usual. Here's another ventricle This has fine crisscross trabeculations consistent with a morphologic left ventricle. And then here from the left ventricular aspect, once again, we see the ventricular septal defect. That is, in the trabecular portion of the ventricle, is completely surrounded by muscle, all consistent with a muscular trabecular ventricular septal defect. When we get up into the left ventricular outflow tract here, here's another arterial valve which appears to have 3 leaflets as well. 1, 2, 3, with 3 sinuses. This one has been transected. And then here we can see a coronary artery arising from within the sinus. This is actually a little higher than the level of the sinus and the sinotubular junction itself. This is all consistent with an aortic valve. And you can see that unlike the pulmonary valve, there is in fact aorto-mitral continuity. So there's fibrous continuity between the anterior leaflet of the mitral valve and then the aortic valve leaflets themselves. But similar to the pulmonary valve, the aortic valve also doesn't have a true round or oval annulus. It does have a crown-shaped annulus, as the half-circle fibrous valvar leaflets have these myocardial interleaflet triangles interposed in between them. And then here is the ascending aorta. So a heart with a muscular trabecular ventricular septal defect.